Welcome to Tooth Talk. So are whitening treatments damaging your teeth? Well, the first thing is when someone comes into the office and asks me about whitening, I always ask them, have you tried an over-the-counter whitening strip? Because they do in fact work. The number one thing you might want to look for in those whitening strips is you want to look for hydrogen peroxide or carbamide peroxide. If your whitening treatment doesn't have peroxide, it doesn't work, okay? Most of the effects that you do see from before and after or right after using a whitening strip that doesn't have that active ingredient is the side effect of dehydration. So when your teeth are dehydrated, they look differently in the light and they may look brighter, but in reality, it didn't whiten at all. But if that's not effective, we do offer an in-office treatment. So what I like in the office is we do a 1 hour higher concentrate of hydrogen peroxide that we deliver custom to your teeth, and then afterwards you get sent home with these trays similar to an Invisalign-like material, and you can do at-home treatments to help stabilize and maintain the whitening effects. If done right, whitening effects can last up to 1 year. If you are a heavy wine and coffee drinker, you will need some touch-up treatments, which is why I do recommend getting at-home whitening trays, which come included in our kit. And you can do that over a period of a few days and maintain that whitening effect. Now, the one thing is different people have different sensitivity levels. So whitening works by opening up kind of like the pores or what we call the tubules of the tooth. And the peroxide goes in there and whitens the tooth from the inside out. So some people, those tubule openings can cause sensitivity. So what we like to do when we send patients home with whitening treatment is to suggest maybe they try it every other day, and you want to see if the whitening causes some sensitivity. If it does cause some sensitivity, on the off day, we do recommend sleeping with maybe some Sensodyne smeared onto the teeth with the whitening tray on to help mitigate some of that sensitivity, and you can still whiten your teeth safely.